Welcome to the Homegrown Heart Podcast, every Friday morning at 7:30 a.m. Mountain Standard Time, with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and considered an expert in her field, exercising after a cardio event. Please help me welcome our host, Dr. Amanda Ryan.
Good morning, Carlsbad, Eddy County, and all our listeners all over. It's Dr. Amanda Ryan, your friendly interventional cardiologist, part of AHV&M, Advanced ASC of Carlsbad, New Mexico, and Partners in Heart Health. In studio with Danny Fletcher from This, That, and the Other, talking about exercise. I hope you caught our New Year's resolution taping, which had some discussion about it, and this week's exciting episode about how to throw a heart-healthy football party. So hopefully you catch all of that. That'll be great. Today we're going to talk about you've had a cardiac event. And again, a lot of the themes during our podcast are going to be either primary or secondary prevention. Again, what is the difference? Primary prevention is you've never had a cardiac event and we're trying to make sure that you don't. Secondary prevention is you've had a cardiac event and we are trying to do everything we can to prevent you from having a second cardiac event. I focused a lot over the last year's podcast and rolling into this year as well on what are our modifiable risk factors. Okay, we've got to change what we can change. I hear a lot of people say, whether it's weight we're talking about, whether it's heart disease, whether it's cancers, they're like, oh, that's just my genetics, that's my family history, I'm stuck with it. And that is not the case. You are predisposed to certain things, you probably have a higher incidence than the next person, but there are many times that our own behaviors or lack thereof are really participating in our risk of developing any of these things. So we've got to say, what can I modify? Regardless if you do have a strong family history of certain things, like I do with heart disease, I can't change my family history, but I can modify my risk factors. You've just had a code STEMI. Again, that's terms that get us all excited at the hospital a little bit. What does that really mean? Again, that is a certain look on an EKG, which again is a fascinating tool. An EKG, again, to think that we figured it out mostly by checking it on our dogs, by the way, realizing that the electricity going through the heart and potential signs of heart damage could be visualized on this paper that looks like a bunch of squiggly lines all over it when you're first starting to look at them. It's really fascinating. You put them in different places across your chest leads as well as your arm and leg leads, and it gives different views of different walls of your heart, your pumping chamber, and really tries to tell us what's going on from a cardiovascular standpoint. Well, in this whole quote-unquote code STEMI, that implies you have 100% blockage in one of your arteries. And again, that's why we develop these rule programs. That's why Cynthia Madrid and Rick Gonzalez and the rest of our team at our local hospital takes 24 hours a day of call along with me or other interventional cardiologists so that we can help get your artery open within 90 minutes if you have one of these events. Let's say we do. You have crushing chest pain, you come to the emergency room, you're told you're having a STEMI. You're scared, you don't know what that means. You're rushed to a cath lab where we quickly tell you as much as we can, but time is of the essence. We open your artery. You do pretty well. We check an ultrasound of your heart afterwards called an echocardiogram. We tell you you've got a stent and your pump of your heart, which should be 55, looks about 40. But don't worry, here's all these 6 medications, and your other arteries look good and you're going to be fine. Okay, now what? Should you be out there walking? Should you be jogging? Should you be on an incline? Is a bike better than an elliptical? Should you be targeting your heart rate to something? Should it be 170, 180? You haven't been very active. Your blood pressure with minimal exercise gets a heart rate of 150 and your blood pressure goes to 180. Is that okay? Do you need constant EKG monitoring so that you can see, is your heart changing in ways that are not healthy as it recovers and you start exercising? Do you need supervision? Should you walk by yourself? Should you ride a bike by yourself? What are your risks of passing out, falling? Is it really going to make a difference if you exercise and having another cardiac event? These are all questions that I get asked very commonly, and I try to make sure that I really address those questions after a cardiac event. This is where structured cardiac rehab comes into play. Cardiac rehab is a structured program supervised by nurses, physicians, nurse practitioners, exercise physiologists that has 3 sessions a week typically for a total of 36 sessions. So it is about a 12-week program after you've had some kind of cardiac event. It is where we're going to go over medications, routine exercise, develop an exercise plan. And of all the programs we've gotten going at AHV&M in the last 3 years, our cardiac rehab program is really something that is one of the most meaningful programs. To see patients post-open heart surgery, post-acute cardiac event, post-stroke, all of these different cardiovascular diseases that are actually in here getting an assessment of where they're at physically and making improvements in a structured, EKG monitored, blood pressure monitored, heart rate monitored situation, I can't tell you the improvement we've seen in our patients. Now, graduation rates vary. Sometimes people have to get back to work. They have other commitments, they have other physicians. It's hard for them to drive back and forth. There's all these things that can factor in to completing your whole 36 sessions. But we're doing pretty well with patients lately. It's also not just exercise and somebody watching you. It's bigger than that. It's goal setting. It's coming in and doing what we call a 6-minute walk test. How far can you go in 6 minutes? What does your heart rate, oxygen, blood pressure do in that 6-minute walk test? Then we're going to sit down and say, okay, this is where we are. This is where we think we need to go. And just the security of knowing that somebody is watching and observing you, because the mental side of cardiac events is very serious for people. Again, depression affects at least 90% of post-open heart and post-heart attack patients in that first 6 months. I think that really surprises people. But I think even if you do well, it's forced looking at your mortality. Knowing that all of us are going to pass away at some point versus being faced with it immediately in an acute cardiac event or needing major open heart surgery is really different. We're often able to push thoughts of our mortality or our overall health to the back burner in our life as we go, and that's the society that we live in. However, when something like this happens, I believe it really forces us to take a look at our lives, our habits, our families, our jobs, all of these things with more of a critical eye to think, okay, we get one chance at this experience. And in a split second, whether that be an acute heart attack, a blood clot, an acute stroke, car accident, or otherwise, that can be taken from us and our time on this earth is done. With that being said, how are we going to make sure that we have the most quality time while we're here, living the most out of this precious life that we have? So I think, again, starting a structured exercise program after an acute event is definitely on a lot of people's mind, but there's a lot of fear in exactly how to go about this. Or there are some people who honestly have never done much physical activity. Or their physical activity has been whatever they did at work or whatever they did in their day-to-day life, but they've never really had a structured program. Recovery is a journey, and it really doesn't matter what kind of recovery we're talking about. Recovery from an acute cardiac event versus recovery from open abdominal surgery versus recovery from an addiction, they're journeys, and every journey is unique. I think sometimes with open heart surgeries and cardiac events, emergent, what we call PCI, that's percutaneous coronary interventions, fancy word for saying we're putting in stents in your heart. Everybody wants to tell you their stories, their journeys, and which is great when you're a patient and you meet other patients, and there's support groups and a lot of positives that can come from connecting with other people that have been through exactly what you're going through. But we have to remember there's sometimes negatives of that too, in the sense of you can't really compare journey A to journey B. Whether your heart is strong or not, meaning whether you have heart failure, whether you've had arrhythmias like atrial fibrillation, whether you've ever exercised, what are your current dietary patterns? Did you take medications regularly? Are you used to that? Do you have a regular, what is your job requirements? What is your financial situation? All of these things are going to factor in to your journey. So one thing I really encourage all the patients of is to remember that they're on their journey. You can get advice, guidance, inspiration, and maybe even discouragement sometime from others. But you've got to remember this is your journey. Do you need weight loss? Do you need stress reduction? How are we going to increase your levels of activity and energy? Again, these are all kind of in a quest to lower your chances of another acute cardiac event. For structured exercise cardiac rehab programs, do we need a referral from our physician? We do. Yes, we do need a referral. And just in the last couple years, our nurse practitioners have been able to refer these as well. The federal government, CMS, was falling behind a little bit in the current times as far as our providers. And it was a little bit frustrating because our nurse practitioner colleagues could not prescribe cardiac rehab, but now they can. They can also supervise it. So those things are great, and that's really helped advance some of our stuff. This is a really relevant one to our practice out here. My doctor is busy, and I have a lot of questions that I need to communicate with somebody about this. What can I really do? This is absolutely where programs like cardiac rehab, there's also a program called principal care management. It's where we say, hey, in the next 3 to 12 weeks, this patient is going to need a little more intensive involvement. They're going to need some therapies that involve sitting down, talking, watching videos, asking questions, getting advice from others. That's where we have taken some staff in our particular office, and other physicians do the same, given them extra knowledge and guidance about post-cardiac events, about cardiac rehab, about heart failure, about open heart surgeries. They can answer a lot of your questions and focus a lot of these different areas so that when you do visit with your physician, it can be a little more focused post open heart, post acute heart attack, because you've had a lot of these questions answered. So you're able to get more direct, more follow-up questions with your physician, and also make sure that we can focus on your blood pressures, your heart rate, your EKGs, that kind of stuff. At my age, I can't see where cardiac rehab would really benefit me. Is it too late? And this is an excellent question. Our average age of cardiac rehab patient is probably 75 to 80. To have 75 to 80-year-old patients go learn to walk on treadmills, to be on ellipticals, to do exercise stationary bikes. We have we have another machine that uses a lot of, it's like a leg press machine and does some arm activity as well. I think some of them are very intimidated when they first see that room. Like, I'm not going to be able to do those machines. And if I could tell you, the tear that really comes to my eye and a lot of our staff when we see them progress, it's super rewarding. The confidence that people really pick up with coming in 3 days a week to these structured exercise sessions, there is no age. We can modify. There is something almost, but we have several patients who, after recovering from open heart, really needed knee surgeries, hip surgeries. So there is no age patient, no orthopedic problem, we can find some exercise that almost every person can do. And again, when we want to say, I'm too old, I'm too advanced age, I have too many orthopedic problems, I have too much this, too much that, we've got to look at our Paralympic athletes. We've got to look at these young kids playing sled hockey. We've got, who have no use of their legs. I mean, we have to really realize that a lot of times what's limiting ourselves is our mind. And that doesn't mean that we can all go run a marathon, because we can't. And that isn't the goal of cardiac rehab either. My family and friends aren't really into this kind of thing. What are my options? It's very hard to stop smoking if your partner or spouse continues to smoke in your home, around you or otherwise. It can be very hard to start an overall health journey when your family, partners, and friends are not on that same journey, or not on any health journey, really. Sometimes in life you have to pick your hard. Your chances of dying from repeat cardiac events go up with every problem that you have. Your chances of lowering your quality of life go up every time you have any kind of event. Sometimes in life you have to pick your hard. You may be able to encourage and change your family's opinion. Sometimes in my family, my mom and I, we're exercising together, we're not exercising together. Meaning sometimes we're not both on the wagon, sometimes we're both not on the wagon. And the exercise wagon can be hard to climb back. It's like a mountain, not a wagon, whenever you haven't exercised in months. But I promise sometimes you can find strength in one another. Sometimes you're at totally different places. You've got a family member who does run marathons, and you think, well, I'm going to go out there and, walk a quarter mile and be short of breath. That's embarrassing. Your family loves you. They support you. You can do different things. You could both go out somewhere. All the time in my medical school career, I had a group of 6 friends. We jogged, we ran. Some of us jogging 2 to 3 miles, that was our major accomplishment. We had colleagues that ran 6, 9, 12, 15, trained for marathons all the time, 5, 10Ks, half marathons, and they would wave bye to us after we all got to the mile and a half marker and go on, and we would turn around and they would go on. We were on a different journey, a different path, but we found ways to do it together. I have too many responsibilities in my day-to-day life. I do not have time. I do not have time for structured cardiac rehab. I do not have time for a daily walk. I do not have time to learn about these medications. Again, I'm shocked overall at the amount of people that are willing to put medications in their body that have really no idea what they do. I talk to people every day about their medicines. We want people to bring lists, bring their bottles, write them down, bring the lists from the pharmacy. All the patients like, oh, I don't know, I just take what my wife gives me. I take what my daughter tells me to. I do. And again, there are times when confusion and memory problems become where you do have to kind of trust someone else to help you with that, and you don't know everything you're taking. But the overwhelming majority of our patients are perfectly capable of knowing what they're putting into their body, but they kind of choose not to educate themselves about it. They also might choose just to take a pill instead of try every lifestyle modification, or see how lifestyle modification can work with your medicines to really decrease your risks. I don't have anyone to help me through this journey. Where can I find emotional support? That is there are so many support groups. The American Heart Association, the American College of Cardiology has different online resources. There are so many different options out there. There are local, there are statewide, there are southwestern in general, United States. There are a lot of different programs out there that people don't know about that really can help you. There are so many online support situations, which can have pros and cons, but there are really a lot of options for how you can meet other people who have dealt with similar things to you. Although again, I encourage all of us to really remember we're on our own journey. You have to play the hand you're dealt in life, and sometimes it's not the best situation. However, there's often things you can do that really can help improve your overall quality of life and your longevity. So the focus of today's session was really introducing you to cardiac rehab, explaining and talking about some of those feelings, frustrations, fears that come after having an acute cardiac event. And we hope to see you next week, where we can talk about some more exciting topics in the cardiology and healthcare sector. Thank you.